Only half of the population has received their booster dose, while only 2% took the second booster against COVID-19. According to Azrul Mohd Khalib, CEO of Galen Centre for Health and Social Policy, vaccine fatigue and distrust in COVID-19 vaccines may be the reasons behind the low take-up of booster doses.
Malaysians often have cited being tired of being vaccinated, worried of adverse effects, like getting sick after being vaccinated, and if being fed up at being told conflicting information regarding vaccines and not being able to spend time to get vaccinated. So vaccine fatigue combined with the trust deficit in both the vaccines and the government are serious challenges or barriers to getting people vaccinated again. And the government needs to convince people to get vaccinated. It cannot force people to get vaccinated. So the government needs to be able to address these issues, but also provide as much information as possible concerning what people can do to ensure that they don't get those kind of effects. Now, again, I have to stress, we know a lot more about the vaccines than when we first rolled them out. Today, we are able to alleviate some of those concerns, but most importantly, the government must be open to answering those questions and to provide information as necessary. Now, here's the thing. At the end of the day, it's your decision. It's people's decision to get vaccinated. You cannot force people to get vaccinated. And so what you want people to have is the ability to make an informed decision on whether or not to get their second booster. And
Azrul also called on the public to get boosted soonest in the wake of possible new waves of COVID-19 infections.
So today, not only do we know much more about the disease, how it is spread, how it causes serious disease, morbidity and premature death, we also have the knowledge, tools and strategies of what works and what doesn't work to protect ourselves. And this includes wearing masks and getting vaccinated. The vaccines that have been rolled out, and majority of this population has already been vaccinated with the primary dose. We know that vaccines work in reducing serious disease, needing hospitalization and critical care and death. However, as we know, there are still many who have not even received their first booster, which is currently at around 50%, and have only taken their primary jab. So it is essential to remind everyone that with this disease and the vaccines that we are currently depending on, boosters are necessary, especially if your primaries are the inactivated virus vaccines. In other words, the Sinovac vaccine, which around half of the population have been vaccinated with. So they are necessary, boosters are necessary to increase the immunity levels and protection against severe disease due to COVID-19. And if you haven't gone for your first booster, please do. And if you already have your first booster, then maybe you should consider getting a second booster after that.